What is ASC-WDS? The Adult Social Care Workforce Dataset, or ASC-WDS for short, is a free service used by over 20,000 care providers in England. ASC-WDS provides many benefits to care providers while collecting data that's used to help plan and fund adult social care in England. It's commissioned and funded by the Department of Health and Social Care and managed by Skills for Care. The data collected is vital to the government, local authorities, the Care Quality Commission and to Skills for Care. Sharon Graham, Head of Service Commissioning, Improvement and Assurance at Barnsley Council said, "As commissioners, we frequently use the data to support the development of our market position statement, market shaping plans and other reports to senior leaders." What data does it collect? ASC-WDS is all about you as care providers and the people you employ. You'll be asked questions about your workplace, such as what care service you provide, how many staff you employ, and how many staff vacancies you have. We also want to know about the people you employ. You will add staff records to help us understand issues such as workforce pay and demographics. The service is simple to use, with clear layouts that have passed assessments by the government. So how does ASC-WDS help care providers? 1. Create, store and manage staff training and qualification records. You can use ASC-WDS to manage and store your staff training records and training certificates in one place. The service allows you to set which training is mandatory for each role, so the records are customised to your needs. ASC-WDS will then alert you when training is going to expire or staff have training gaps. One ASC-WDS user said, "I think it's very good, especially if you regularly update it. It helps us in our job to see expiring training. It makes our work easier. It also generates reports that you can use to help organise training, using staff one-to-ones or share with others, including the CQC." Another ASC-WDS user said, "I rely solely on ASC-WDS for my training matrix. I love the training report matrix because I can update it and download it every week, and then the whole company can have access to it. I love the platform, it's really good." 2. Share your data with a CQC or local authority. You also have the opportunity to share the data you store inside ASC-WDS with a CQC and your local authority, so they better understand your workplace. It's completely up to you, but it can save you time when you're due for inspection. 3. Claim funding. Having a fully up-to-date ASC-WDS account means you'll be eligible to claim from funding from DHSC for training your staff. You can easily check whether your data is up to date and meeting the funding criteria. Emma Webb, Care Coordinator for BGS Healthcare Limited said, "ASC-WDS has been vital in helping us manage our staff data and access funding easily. Last year, we successfully claimed over £30,000, receiving 60% upfront and the remainder once courses are completed. This year, we've already claimed over £12,000 with more in progress. The service has so many benefits to your organisation, such as helping you to claim funding, comparing your workplace to others for strategic planning, and managing staff records and training easily to support development. Best of all, it's free to use." 4. Get offers and discounts through the ASC-WDS Benefits Bundle. To say thank you for using the service and supporting the sector, you'll also have access to special offers and discounts across Skills for Care's products with the ASC-WDS Benefits Bundle. Special prices on e-learning and discounts across a range of Skills for Care's quality assured training providers. 5. Benchmark your organisation against other local providers. With over 20,000 users, you can benchmark yourself against other care providers in your local area who provide the same type of care service as you. By sharing your anonymous data, you'll compare yourself on workforce metrics such as staff turnover, vacancy rates, and care worker pay. You can also choose to compare your data with good and outstanding providers in your area. One ASC-WDS user said, "The benchmarks are great. I use that quite a lot to see where we rank in our area, all of them, staffing and sickness in particular, retention and pay." 6. Start using the Care Workforce Pathway. By mapping your staff to appropriate job roles, you can use the Care Workforce Pathway to support career progression and professional development. 7. Help the sector and have your voice heard. And last but certainly not least, Your anonymised data is used to inform the Department of Health and Social Care's decisions and policies that affect our sector. Become part of the national picture and have your voice heard by key decision makers and the government as they plan for the future. We'll keep you informed on how your data is helping the sector and provide updates on continuous improvement to the service in the ASC-WDS news section.
What if we employ a large number of staff?
Many larger organisations with multiple locations and hundreds or even thousands of staff choose to use our bulk upload functionality, where all data can be uploaded in one visit.
So how do I get started?
The service is built to meet the needs of all care providing organisations, from small care homes to national care providers with hundreds of locations. It takes just 5 minutes to get started by creating your account. All you need are a few basic details about your workplace and the care service you provide, which will be checked and validated by our dedicated support team. If you need any help, our dedicated support team are available by phone or email. So why not get started today and start accessing the many benefits of ASC-WDS while helping us make the sector better for everyone? To create your account, visit the ASC-WDS page on our website or scan the QR code.